Every time you go to your doctor's office, they take your blood pressure and give you two numbers. One's called the systolic, and the other's the diastolic. But what do those numbers really mean? And which one is more important to keep under control? That's exactly what we're going to cover today. In this video, we'll break it down so you know exactly what those numbers mean and what you can do about them. First, let's look at what blood pressure numbers actually mean. Whenever your blood pressure is measured, you'll see two numbers. The top number, called the systolic pressure, is the pressure in your arteries when your heart contracts and pumps blood out to the body. The bottom number, called the diastolic pressure, is the pressure in your arteries when your heart relaxes between beats. So, why should you even care about blood pressure? It's not really about the numbers themselves. It's about what they mean for your body and your health. High blood pressure is one of the biggest risk factors for artery damage, which can lead to heart attacks, strokes, and even kidney failure. Here's what happens. When blood pressure stays high over time, it puts extra strain on your arteries. As we get older, this becomes even more common because our arteries naturally lose flexibility and stiffen, which only makes things worse. Over time, that constant pressure damages the inner lining of your blood vessels, weakening them and allowing plaques to build up. And if one of those plaques ruptures, that's when heart attacks and strokes can occur. All right, what's actually considered a normal blood pressure? According to the latest guidelines, normal means your top number, the systolic, is under 120, and your bottom number, the diastolic, is under 80. If your systolic is between 120 and 129, while your diastolic is still under 80, that's considered elevated. But once the systolic reaches 130 or higher, or the diastolic hits 80 or higher, that's when it's called high blood pressure. Now, that doesn't always mean you'll need medication right away, but it does mean your risk for heart disease is going up, and it's definitely something to work on with your doctor. So, which number is more important, systolic or diastolic? Honestly, the answer is both, but the way we've thought about this has changed over time. Years ago, doctors focused mostly on the bottom number, the diastolic. Later, research showed the top number, the systolic, was actually a stronger predictor of heart problems, so that became the main focus. But now, newer studies make it clear that both numbers matter. Sure, systolic still gets a bit more attention, but diastolic is just as important, and it's not something you want to overlook. Now, what's the best way to lower your blood pressure? The truth is, there isn't one single solution that works for everyone. The focus should be on the basics: eating healthy, staying active, managing stress, and keeping a healthy weight. Those are the daily habits that make the biggest difference. But sometimes lifestyle changes aren't enough. Some people need medication to bring their blood pressure under control, and for others, genetics play a big role, even if they already live a healthy lifestyle. The best approach is to work on what you can control and partner with your doctor to manage the rest. At the end of the day, both numbers matter. Managing them with healthy habits, and, when necessary, the right medication, gives you the best chance to protect your heart and enjoy a longer, healthier life. If you'd like to understand more about systolic and diastolic readings, be sure to watch the video linked at the end. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.